Welcome, everyone. I'm Kitty Boone. I work for the Aspen Institute, and it's really wonderful to see so many people here on a Friday afternoon at 3:30, no less, right before the rain. Yeah, prime time. Still wishing it was summer, but actually the two trees outside that are beginning to turn yellow are making me very sad. Thank you for coming, and thank you to our guests I'll introduce, and thank you to Bob and Soledad Hurst, who have made us, given us the opportunity to bring remarkable leaders and thinkers throughout the summer to Aspen. The Hurst Lecture Series is very important to us. Thank you so much for your support of the Aspen Institute. I think you all have a program, so I'm not going to read bios directly, and I'll just jump in and introduce quickly our three Democratic governors today who are here. Luckily, because this coincides with the meeting of the Democratic Governors Association. Governor Michelle Lujan Grisham is to my immediate left. She's here. She's in her first term as governor of New Mexico and having just been elected after several years in Congress. To her left is, and this isn't purposeful that it's going left to left, but anyway, is the governor of our great state of Colorado, Jared Polis. It's really wonderful to welcome you to our stage, Governor Polis. I don't know that we've had you too often, and so welcome. He has also just been elected and served in the House of Representatives for 10 years prior to becoming governor of the state. And then to his left is Governor Kate Brown of Oregon, who has been governor since 2015. 2015, we're going to edit this tape, and has just been reelected in her second term as governor of Oregon. I will also say that Governor Brown is a Rodell Fellow at the Aspen Institute, and that is a 24-month fellowship program that's designed to bring elected officials from both sides of the aisle together who have demonstrated the ability to work responsibly and smartly across the aisle and really think about bringing greater civility to public discourse. And I find the Rodell Fellowship one of the best things we do at the Aspen Institute, so it's great to have you here. And I don't know if you want to add on to that at all, but every year we have 24 fellows. We have two that are running for president in the Democratic primaries right now, Kamala Harris and Pete Buttigieg have both been Rodell Fellows. So you want to share a little bit about that?
Sure. I'll just make a couple quick comments. Mickey Edwards was head of the program when I came in, and I still remember the conversation I had with him. In order to be a Rodell Fellow, you have to be under 50, and I was like 49. And he's like, we're going to get you in. I want to get you in. I want to get you in before you turn 50. And so I got in and did the program. I think for me it was one of the most intense leadership programs that I have ever had. And believe me, in my 25 years in public service, I have had a lot of leadership training. This was definitely the most intense. What I loved about it was the camaraderie, colleagues, Republicans and Democrats. I loved the ability to have honest dialogue, not so much about issues of the day, but about leadership. And it's truly an incredible program, and I'm loving staying in contact with a couple of my classmates, and we connected in a lot of different ways. So
really
thank
great.
You for all of you who are supporting the Aspen Institute Rodell Fellows program. It's really extraordinary.
Okay, thank you for that. So we have an hour, and we'll dedicate the last quarter of it to Q&A, and we won't be able to cover, therefore, every issue that's important to all of these governors, but they've issued some interesting topics for us to cover today, and things that they're working on, that they're proud of, and that may foster some questions by you all, and certainly in Q&A. If we don't touch on an issue, feel free to bring it up. I'd like to start by talking about things that are critical to each state, and those are issues of education and healthcare. And so I thought that we would start on education with Governor Polis, who just enacted in his first 9 months in office free full-day kindergarten, and I think that's very important. And Governor Polis, why don't you talk a little bit about that, and then I'm going to ask our other colleagues to add on, because everyone on this stage is doing some pretty amazing things.
So, where Colorado was before is kids were able to go to kindergarten half day. You had to pick them up around 11:30 or noon unless their parents could pay $300, $400, $500 a month for full-day kindergarten. So you had a learning gap and achievement gap based on economic lines, and too often racial lines, before kids even entered first grade. So kindergarten is every bit as important as first grade and second grade and third grade. We're going to treat it like that in Colorado. All the data shows that early childhood education is so important. It's something that Governor Lujan Grisham's been working on, Governor Brown's been working on. It's where the data drives you. And I was, of course, an advocate in my years in Congress for early childhood. If we truly care about these persistent learning gaps in our society based on geography and race and income, we have to give every child a strong start. In addition, putting children first is the reason for full-day kindergarten, but in addition to that, it saves families money in Colorado, families that were able to scrap together the $304 a month, but certainly appreciate having that back to shop at local stores, invest in their community, save for retirement, or save for their kids' college. And of course, it also has an economic benefit to our state by giving more flexibility for second parents or single parents to re-enter the workforce sooner if they choose, knowing that their kid has full-day kindergarten. There might be a small fee for aftercare if they're working traditional work hours, but nothing like that $300 or $400 a month.
Governor Polis, what's the total budget of the state of Colorado, and how much of that is allocated to education?
We're about $31 billion for our state budget. Education is the biggest, most important thing we do. It's just under half of our state budget. Over 40% goes to our early childhood through 12th grade, and then that includes our higher education system as well, very close to 50%. And I would just add that by funding full-day kindergarten, we also freed up 5,000 free preschool slots for low income. So those are means tested, but low income families in Colorado, we've now almost addressed the entire wait list. We hope to achieve that next session, so at least eligible low income families can have preschool as well to give their kids a strong start.
So last question for you on this at this moment. People in this community frequently talk about the fact that Colorado is low on the totem pole when it comes to per capita student funding in the state. And as many of you know and probably participate to some degree, we do sell marijuana now. And when we initiated that, some of the tax revenue was to generate money for education, which seems sort of oxymoronic, but nevertheless. Is that working? Are the tax revenues helping you fund free kindergarten and investing more in education?
So let's put this in perspective. So we just celebrated $1 billion in tax receipts for marijuana. That took 5 years. Now, a little bit tail-ended, but we're somewhere around $300 million a year in tax receipts for marijuana. Now we have a $31 billion budget, right? So this is less than 1% of the budget. We were able to tap those funds for capital for the adjustment to full-day kindergarten. So we were able to deploy money to almost every district in our state to help them do capital improvements, desks, chairs, new dividers, to help prepare and change half-day classrooms to full-day classrooms. Not the construction side, that's usually done through local bonding, but they got an automatic increment, a one-time increment to adjust to full-day kindergarten. That's why over 99% of our schools in our state are offering full-day kindergarten in the first year it's funded. That number would have been lower if it wasn't for the marijuana funds. It probably would have been in the mid-90s. We hope to be at 100% within a year or two.
That's really fantastic. Governor Brown, you have also worked really hard on a Cradle to Career initiative, which is something that, again, our community, through the Aspen Community Foundation, funds a lot in the Roaring Fork Valley. Just what does that look like in the state of Oregon?
So I've been working on this issue for over 20 years. I ran in 1992 on stable and adequate funding for our education system in Oregon. In my last campaign as governor in 2018, my platform was stable and adequate funding for our education system. In this last legislative session, we were able to pass a tax package, House Bill 3427, the Student Success Act. And the goal of this act is to create a seamless system of education, literally from cradle to career. And for me, what that means is making sure at the early childhood stage that families have the support and services they need to thrive, and that our children show up to kindergarten ready to learn. It means making sure that our children achieve appropriate benchmarks, reading by 3rd grade, transitioning to middle school, and that we have more of our kids coming onto high school ready to graduate. So it also means making sure that our kids graduate from high school with a plan for their future. And that could be career and technical ed, it could be an actual technical vocation, it could be university or community college. So truly a seamless system that our children can go literally at any stage through. The big issue for us was the funding component. And because we were able to pass this very large tax package, a $2 billion additional investment per biennium, that's going to make a significant difference. Just to give you a sense, $400 million of it a year will be dedicated to early childhood education. So that is significant. And it includes home visitation, early intervention services, and obviously extending pre-K programs. My goal is to achieve targeted universal pre-K in Oregon.
That's fantastic. You also have enjoyed a 5% increase, I think, in high school graduation. And what prompted that?
Well, we had one of the lowest high school graduation rates in the country. And for me, we know 30 years ago, if you didn't graduate from high school, you could get a good paying job in Oregon in farming or fishing or agriculture. That's no longer the case. Those jobs are few and far between. I think it's true in any state across the country that you must have a high school diploma. So we have made a significant investment in career and technical education and making sure our students show up for school ready to learn at the high school level and or ready in the classroom at the high school level. And the career and technical education is a total and complete game changer for our students. If students have hands-on learning, it awakens them to the power of their potential. It connects classroom to career. And frankly, it gets them ready for the world of work. So it's a win-win-win for employers, it's a win for students, and certainly we're seeing the success rates in our increased graduation stats.
Really great. Governor Lujan Grisham, you're making big investments in higher education, and I think that's something I'd love to have you talk about, although you can certainly expand on any of the initiatives that others here are talking about. Maybe some of you are aware that for whatever reason, the governor of Alaska has just decimated investment in higher education in the state of Alaska. And yet New Mexico is going in the opposite direction. I'd love you to talk a little bit about what that's about and how you've achieved that.
Absolutely, and I'm going to do what all good governors do, is brag about all the education initiatives that we're doing, because you gave me a giant mic that's bigger than I am, so I'm going to go for it. New Mexico, prior to my election, and I worked in state government as a cabinet secretary for 18 years under 3 different governors, and I've seen New Mexico do really well, and I've seen us be 50th in every public health outcome that you can imagine, and I was elected on the cusp of being 50th, including 50th in education, and also being 50th in the country in child well-being. I mean, it's outrageous. And so the way that you address that, and I get to higher education in this design, is there's a terrible echo, is we have to have a paradigm shift in this country. It used to be all about higher education and preparing for college. And we didn't think about entrepreneurs and job skills and job training and life training and basically preparing young people for any number of circumstances. And now I'm seeing some states, move to the opposite, which is we don't care about universities and community colleges anymore. We're going to provide vocational training and career enrichment in high schools, and that's going to be enough. And the reality is, if we're going to have diverse, productive, growing economies and quality of life for families in all all of our states. It is an all of the above approach. It is not one or the other design. And I'm hoping that the country's learned from those mistakes. And New Mexico's in a really prime position, 2 million people. We are small enough to wrap our arms around getting it all done and starting as early as possible. So we have, I think it's still the first ever in the country, early childhood education department. So you move everything from infant mental health and home visiting to early education for 3 and 4-year-olds. And we hope that by the end of this next legislative session, which is this January, only 30 days, I know you're envious about that already, you governors, we're going to get a fund that has at least $250 million, but it could be as high as $400 million, which allows us to productively guarantee that we have resources for a 5-year plus period to create the infrastructure, to do the building, to do the curriculum, to build the capacity to serve 3 and 4-year-olds. I also hope to launch that into universal child care support. When families can't afford child care, we already create problems in education, and we're doing a moonshot in our public education. And what that means for me is we just declare that we will never be 50th again, that we will make sure that education is a priority, and the single largest set of investments in education in New Mexico were just made in the last legislative session, $400 million. Our total state budget's only $7 billion. So $400 million is a significant investment, and it's for extended learning, it's focusing in elementary school, it's making sure that we have graduation coaches in elementary and mid-school and high school, that we're really clear about that community schools isn't a pilot project, it's a statewide reform. And that gets me then to school-based health centers, everything. And it gets me to, and paying teachers, giving value-based pay, creating for the first time ever in our state society that we are valuing and respecting our educators so we can create a pipeline, which gets me to higher education. If you want educators, and we want to focus on public education and outcomes, you better be growing your own educators because there's a national shortage. And to do that, you got to be investing in higher education. So we made it a continuum. We're clear about getting that done. We're going to pay for professional development. We are investing in higher education, as you said. We are also requiring that we have better outcomes from higher education. And you do that by being a full-on accountable partner to higher education, and they have to be part of that community school design. If you separate each part of your public education system, then one of them does well and one part doesn't, and it's all connected. So we've decided to connect it in a continuum. And the last thing, I'm lucky enough to get to govern in a state that has 2 of the 5 national labs. So for one of the poorest states in the country, we have more PhDs per capita than any other state. So what are the disconnects with poverty? Well, we recruit our PhDs in. We have to make sure that we're not doing that New Mexicans are in that pipeline to do that incredible work. Some of the most incredible national security work in the entire planet has been done right in the state of New Mexico. So our education priorities are all about solving those disconnects and changing the paradigm once and for all and succeeding in ways that most of us in New Mexico only imagined before now. So I'm lucky to have the support of my legislators and to have enough revenues coming in to make those a priority and to have access to those investments.
That's wonderful. Thank you. I could talk about education all day, but I'd like to shift a little bit to something that Governor Polis suggested before we talk, which is the other big issue on any governor's agenda is health care. And we're embroiled in all kinds of health care debacles in this country. One of the things you just accomplished, Governor Polis, was somehow getting insulin capped at $100. I'm not quite sure I know what that means, but let's talk a little bit about health care. And why don't you start and talk about the kinds of initiatives that you're trying to engage in the state right now?
Yeah, I mean, and where the rubber meets the road is with governors and with states. So, rather than kind of, being part of this, national debate, which is sometimes frustrating to watch, where people are swaying back and forth and saying, is it single payer? Is it 5 payers? Is it Medicaid? Is it Medicare for all? We're just saying, look, we have this landscape. We can do a lot more with it in our state to save people money on health care. So my very first act as governor was to create an Office of Saving People Money on Health Care. And we're already delivering.
Is that what it's called?
Yeah, the Office of Saving People Money on Healthcare, and our very capable Lieutenant Governor Diane
I love
Primavera is the head of that office. So, and that's their charge. We're going to save people money on healthcare. So, there was no real concerted effort around that in state government. There wasn't one agency that owned the saving money piece. So we said, we got to push across all the agencies that have a part of healthcare. So Western Colorado, this is particularly transformative. Here in Pitkin County, across Western Colorado, with our reinsurance package that we were able to get into law, Oregon has a similar one. Rates are quite literally coming down here in the individual market by about 30%, January 1st. And that's transformative, right? I mean, and this is transformative for a couple reasons. Not only because it saves people money, it also opens up the ability to be insured to people who simply can't afford it at its current cost. So by costing about a third less, it allows a lot more people to access healthcare insurance on the exchange, the individual market, which is the most price-sensitive part of the market, right? If you have employer-based, obviously employers grow and employees grow about their share, but it's less price-sensitive than the individual market, where literally either you have it or you don't because you can't afford your rent if you pay for healthcare insurance. Now, a lot of our reforms going forward are also targeting saving employers money in the employer-backed market and the small group market. We're modeling that after an effort that's going live in Summit County in January, which is the alliance model. And there's similar work on the ground in Eagle and Pitkin and La Plata County, and we're looking at a statewide alliance model. This effectively allows for a negotiation with providers across different insurers for customers to gain leverage. So what they were able to negotiate in Summit County, in the small group market, the individual market, and it'll be the large group market announced soon, there's additional savings of about 15 to 20% on insurance premiums. And none of this has any degradation in coverage or terms of the insurance. These are the exact same policies, but effectively we're able to have negotiations with a larger group, with the providers. In many ways, the work that insurers should have done, and one of the reasons we always talk about a public option, we're also pursuing that in Colorado, is insurers haven't done enough to bring down rates. So we're gonna boost them a little bit. We're gonna kick them a little bit and say, you gotta do this. We're gonna go across different insurers, use those lives to go in directly to the providers, bring down rates. So that's the key thing. We have 6% uninsured in Colorado. With the reinsurance plan, with the alliance model, I feel that alone will get that down a couple percent. Because obviously people want healthcare insurance, just a question of they can afford it. And then, of course, we want to tackle the rest with the goal of having universal access to healthcare. We also did some things on the qualitative front, which was your original question. And by the way, we have no beef with pharmaceutical companies or insurance companies if they work to save us money. The problem is, it's not an inherent beef with them. It's just that the system doesn't work. The very same pharmaceutical companies, which are making huge profits, are selling the same drug in Canada at 1/8 or 1/10 of the price. So if we had that, and we wish that they fixed that federally, I wish Medicare could negotiate for prescription drug rates. We did pass, and Florida, with Republican governor, also passed a prescription drug importation pilot package, and we're working closely with Secretary Azar to get the waivers we need to be able to buy prescription drugs in Canada in a larger way. You can do that as individuals with your own money, but in a way that's either Medicaid-based or private insurer-based, to provide competitive pressure to bring prices down here. So we've got to make progress on all those fronts to save people money, and the states are in the forefront, because right now, while we need action nationally, it just ain't happening, so we're doing the most we can with what we have.
Governor Brown?
That's a hard act to follow. Our uninsured rates are approximately the same as Colorado's. I think it's critically important that every Oregonian have access to health care, and I believe that every American ought to have access. One of the areas where governors can play a key role is making sure that we are taking a leadership role in fighting the current administration. And so I've partnered very closely with my Attorney General to fight the administration's attempts to roll back the ACA, the Affordable Care Act. They want to basically, and they're fighting in court right now, to eliminate coverage for Oregonians, for Americans with pre-existing conditions. I find that appalling, and we're going to continue to fight every step of the way. We are also working, I loved that I was able to sign our our children's health care package. It covers every single child in Oregon, regardless of their immigration status, and we are at 100% coverage for our children now. And then lastly, one of the areas where my state has played a role is around women's reproductive health care. And I was able to sign into law legislation called the Women's Reproductive Health Equity Act. And the bill ensures that every woman in the great state of Oregon will have access to the full complement of reproductive health services, regardless of her income, regardless of her zip code, and regardless of her immigration status. And I think that's where we should be as a nation. And I'm going to fight to help my other states make sure that everyone has access to full coverage, not just having politicians determine who gets what types of coverage.
Interesting. Governor Lujan, Grisham, do you want to add anything, or should we move on to the next topic? Because I have one for you.
I have this big microphone. I
Okay,
can't
go
believe
for
you
it.
keep asking me. I ran for Congress in 2008 and didn't win that election, but I ran because for the first time, certainly in my career, the Democratic candidates were talking full on in the primary about healthcare reform. And I wanted to be in Washington to be at the forefront of that. And I agree with Governor Polis, that's been a bit disappointing since 2008. And I spent the majority of my career being a healthcare advocate and navigator, primarily for older persons. And I'm a caregiver for my mom. So I deal with doctors and prescriptions and co-pays and how many folks have ever tried to read an explanation of benefits, because that's an oxymoron for any insurance bill or for Medicare, right? They are not readable, they are not translatable, and you have to have an Excel spreadsheet if you're chronically ill to figure out whether you owe a copay or a deductible or not. And it's outrageous, and it's one of the reasons that so many, particularly now rural hospitals around the country, spend more time and make more money suing patients. And patients can't put together a defense because it's nearly impossible to figure out what you owe and what you don't, because it's the least transparent process there is. And even if it was, when you are sick, that is not the place where any person, patient, or family member ought to be paying the most attention to. So I am thrilled that primarily Democratic governors, but not entirely, are really focused on making a difference for their citizens in healthcare. And so I did the following things. In New Mexico, we embedded all of the Affordable Care Act protections into state law. So pre-existing conditions, staying on your parents' insurance, all of the things that are really meaningful, all the preventative free health care and screenings, all required, whether you're in Medicaid, of course, or whether you are in the private market. So that's done. We are looking at ways to reduce prescription drug costs and have launched our own importation efforts, figuring out ways to navigate that. And I was successful back before they figured that out. As a cabinet secretary, I imported flu vaccine, and I did it through Illinois. So Illinois got into trouble, and New Mexico just got flu vaccine. So brilliant, and now I got to figure out ways. We all do, but the more states who engage.
Governor Pritzker's not here, right?
It's okay. It's okay. Should be a little competitive, but states who are doing this collectively are going to shift again the framework for healthcare protection and healthcare access. And New Mexico's looking at a way to do universal healthcare through a vehicle we are calling the New Mexico Health Security Act. And one of the designs of that is to allow folks on the private market to buy into Medicaid, because more than 50% of New Mexico's population is on Medicaid. So it is now the large insurance-based effort. So instead of running from that, and I do want folks to be making enough that their income stability moves them away from those public programs, but here's the other aspect. Like Medicare, Medicaid and Medicare are the biggest payers in all of our hospitals and community health centers. It is the payment structure for most of our healthcare infrastructure today in many states. Certainly it is in rural counties and communities. So it makes more sense for a state like mine to invest in opening up Medicaid in ways that treat it more like a hybrid to protect people who can't afford to be on the private market, but for folks who are being priced out of the private market to have choices and to get the full benefits and coverage through programs like Medicaid. So we hope to be one of the first states to figure out how to do that and to do it productively and to cover more New Mexicans and to make it more affordable for them to have access to quality health care in the state.
Okay, so this is amazing. Half your population is on Medicaid, so this is going to lead to the next area that I wanted to ask you all about, which is your respective economies. Nationally, we're enjoying a low unemployment rate, 3.7% as of today. More jobs added every month. It's up or down slightly, but we seem to be riding a wave of low unemployment. However, if 50% of New Mexico's citizens are on Medicaid, I suspect that your your labor numbers are slightly different. They are. And I'd love to have you each talk a little bit about what your state's economies depend on and how you're looking at job growth. Certainly, things seem to be going well, but maybe not as uniformly well as the picture might be painted nationally. So maybe you could talk with your big microphone about what you're doing around your economy. How is it changing? How is it progressing? And just quickly, it's Los Alamos Labs and Argonne? Are those the two? What's the other lab?
It's
Argonne is Illinois.
Sandia.
Sandia, okay.
So Sandia Labs and Los Alamos Labs. And New Mexico's relied on two major economic efforts, oil and gas and agriculture. So when those prices, those commodities drop, it's boom or bust, New Mexico really suffers, and there's been no real diversification in our economy ever. So I certainly ran on a platform that you have to diversify your economy. You've got to meet the needs of a varying economic structure that allow us to weather the valleys and the highs of an oil and gas or a volatile economic environment. And that's exactly what we're doing. So you're right, we're about a point higher in unemployment if you look at our urban areas. Some of our rural areas have 15% and up unemployment. So some of the poorest counties in America in New Mexico. So we're doing all of the above. It's a 10 economic sector strategy. We launched all 10 after this legislative session and got support for all of it. And I can just quickly, cybersecurity, where New Mexico's been leading, and God knows this country needs an effort to deal with cybersecurity issues and attacks. Value-added ag, so we plan to be the country's largest hemp growers and producers. You try to catch up. We're doing movie industry and have seen multi-billion-dollar companies land in New Mexico for more than 10-year commitments, NBC Universal and Netflix. We are now the land of large data centers, and Facebook has moved in, and more are coming. We are doing bioscience. We are doing renewable energy and have one of the most robust renewable energy investments and innovation occurring. And so trade, we've opened up our ports of entry and are working very hard in spite of a spiteful immigration platform that would close the border. We're looking at ways to be meaningful, have a safe and secure border, but allow trade. Trade, particularly for our agricultural economy, is critical, but it's also in our high-tech efforts. We're doing more high-tech investments that move the high-tech work that goes on in the defense labs out into the private sector, and we've got a lab in Los Alamos that is promising to cure Zika and any number of other issues related to pesky ticks and mosquitoes around the world, which do not only have a public health issue, but impact, in fact, food sources for the future. So those investments have made a difference. And now New Mexico, who was 50th, I bet you could have passed that multiple choice quiz, in economic growth in the country, is now one of the fastest growing economies. We've been in the top 10 since May and intend to stay there. And I'm very proud of that fact and very excited about where New Mexico is headed in economic diversity in the state and in the country.
Okay. Governor Polis.
Wow, hard act to follow, right? I agree completely with Governor Lujan Grisham in terms of the premium that we should all put on diversifying our economy. Colorado, just by its nature, its greater population, is a little further along in that regard. We have ag and we have oil and gas, but there's smaller sectors in our state. So we have no control over international commodities pricing. That's frustrating. As governors, you have no idea if your oil industry or a big part of your ag industry will disappear, which it can, and it has in the past, and it will again. You just don't know. There's good times, there's bad times. So you want to make sure you have is a diverse and thriving economy to round out those hills and valleys. And so we are working on that. We have that. Obviously, on the energy front alone, we're growing jobs in renewable energy, 9% job growth, solar and wind. We have a strong tech sector. We also pass a lot of policies that encourage additional economic development. We did a major tax cut for 144,000 small businesses. Essentially every retailer in Colorado with sales under $12 million a year gets a significant tax cut. We're working on cutting the income tax rate as well. Those are two of our top priorities. But think about for a moment how the healthcare reforms and the kindergarten and preschool reforms free up money and are stimulative to the local economy, right? Money that would have gone to kindergarten now goes into local stores, restaurants, or somebody starting their own business. Saving a third on healthcare means that that person has that resource to maybe add a deck to their home, right? And have construction workers do it, or start their own business, or spend time in our communities. So having that, freeing up that money, not only does it increase the access to kindergarten and healthcare, but for those who were affording it under a strain, it frees up that money to reinvest in the local economy. The very conservative Colorado Springs Gazette editorialized in favor of full-day kindergarten, saying this is like a tax cut for families, because that's essentially what it is. You are no longer having to pay $300 or $400 a month for kindergarten. It's now treated just like first grade and second grade. Therefore, you have that $300 a month for your family budget, which instead of it going to government. So that's kind of what we're working on here in Colorado, making sure that families have more monies in their pocket, that's reinvested in our local economy. Of course, here in Aspen, you have a thriving tourism and recreation economy. A big focus of ours is continuing to grow that, protecting our treasured public lands. We just did a major executive order around wildlife corridors last week to better protect our large, big game and wildlife. I just came from Rifle yesterday, where we had a meeting of our parks and wildlife commissioners, because we've really elevated parks and wildlife, our state parks, our public lands, as not just a treasured part of who we are as Coloradans. I mean, really our very identity is around our wild areas, but also a source of fun and recreation, and an important source of jobs and economic growth in our state with the fast-growing outdoor tourism and recreation industry.
Governor Brown.
I'm like, yes, all of the above. Oregon has one of the fastest job growth rates in the country, and we have, over the last couple of decades, been able to diversify our economy. I was hoping that Governor Polis was wearing Nikes. Unfortunately, he's not. I can't identify the brand.
This is Ultra. It's a Colorado company, a division of VF Corporation, which we lured to Colorado.
Our outdoor rec and retail sector is absolutely booming. Our technology sector is thriving. Our manufacturing sector is doing quite well. And our ag and natural resources also doing well, except of the global dynamics obviously having an impact there. I did tell Governor Polis that I think our cannabis beats Colorado's cannabis, hands down.
They think they got us on hemp over here. They think they got us on cannabis here. Walk down any street here in Aspen and you'll see.
And I know I can't beat you on microbrews, but our Pinot Noir is the finest in the world. So there you have it. However, unemployment, very, very low record unemployment. However, we still have sectors that are really struggling, underserved communities, our communities of color, our low-income communities, and our rural communities. So my focus has been around how do we invest in those communities and give them the tools and resources to thrive. particularly for rural Oregon. It means investing in affordable housing, workforce housing. It means investing in water infrastructure. I know you all think it rains all the time in Oregon, but we have a very low rain half of the state. Number 3, we have to provide broadband to all of our schools. I think we're almost there, but we need to make sure that our businesses and our families across the state have access to the internet. So we're really focused on those types of tools, along with investing in roads and bridges to ensure people can get safely and efficiently where they need to go. We passed a transportation package that, for the first time ever, invests in public transit statewide. So those are the kinds of investments that really make a difference for families, and I hope will enable all of our communities to be successful and thrive.
Okay, so I'm going to eat into a little bit of Q&A because I want to end the questions with some things about the national stage. About 2 or 3 weeks ago, we were very fortunate to have Rahm Emanuel, the former mayor of Chicago, address an audience, a full-packed audience here in Aspen. And I've also had the good fortune times to listen to Mayor Bloomberg, who the Aspen Institute works on a City Lab program with, talking about how critical cities are and where the real action in the United States is in cities. And we're sitting with 3 governors, very important states, who might have a different take on the role that states play. And at a time when our federal government seems to be losing some level of confidence, depending on what polls you look at and ratings of approval in Congress and things like that. Would love you to talk first a little bit about how you see states in this sort of complexity of America and the system of American governance. And then I want to get to some issues, Governor Brown, that you have very big passions around: voter access and voter registration. Oregon is doing some very, very interesting things that are exciting to share. So maybe for the next 5 minutes before we open it to Q&A, we could talk a little bit about the role of states in America, and then going into an election season, how do we improve the electoral process? I should also preview this by saying that Colorado, New Mexico, and Oregon are all signatories of about 12 so far that are the National Popular Vote Interstate Compact, which would suggest that the popular vote in the state would govern what candidate would actually get, right, the electoral votes. So that's very interesting that these 3 states represent that compact. But let's talk a little bit about Governor Polis. Let's start with you. You've been in the House of Representatives for a long time. Now you're governor of the state. What's different? What's more exciting to you about being governor?
Yeah.
And where does the power really lie here?
So first, interesting on the national popular vote, we're actually, I'm pretty excited by this. We're going to be the very first state in Colorado to actually have a vote on it. All of you that are Colorado residents, and those of you who are, and I hope you move here so you pay taxes in our state. 2020, it'll be on our November ballot. So we are, and this is really important. I love it when Colorado voters are front and center. I mean, this will either give it a boost nationally or kind of turn the momentum against it. So very important. We'll be the first state ever to vote on this. The people, that is, next November. So as if there weren't enough reasons to vote. That's whatever your feelings are on that, it's very rare you get to vote on a aspect of our United States Constitution. So that's pretty cool. First of all, you talked about kind of cities, state, federal. I'm really thrilled to be at the state level. I mean, the things that drove me to run for office: early childhood education, healthcare, access and saving people money, growing the economy. Really, the state is really in a position to be a prime driver. Now, on other issues, and I think I saw your mayor and a city council person here, on something like affordable housing, absolutely anything you do, no matter what you do, involves working very closely with cities and counties, because cities and counties in our state, and I think most of our states, have pretty much complete authority over zoning and what gets built where, and height limits and all those things. And it's very intense local discussions about those, if you as Aspen residents haven't noticed that. And it's not for a governor to come in and say, you need to build this here. It's for us to try to, in general, with sort of a carrot approach, try to incentivize projects that make sense, because communities are strongest when people that work in communities also have some way of living in those communities. But that's absolutely a very important part of the dynamic and the relationship with cities and with counties. At the federal level, our politics isn't working well, right? Governor Lujan, Grisham and I experienced this in Congress. I mean, even in the realm of immigration, sort of the common sense things that you think you could do, like putting DACA into statute and providing relief, which even Republicans say they want to do, and of course Democrats want to do, even that is elusive. And as a result, you have hundreds of thousands of people, DACA recipients, that worry about whether they'll be able to work the next week or the next month and the next year. So that political system really needs the kind of collaboratory approach that we have in the States. And I'll just I mentioned two of our examples, reinsurance and kindergarten. Not only were those bipartisan here in our state, strong support from Republicans and Democrats as we got those through the legislature, but the prime sponsor on full-day kindergarten, the top of my agenda, was a Republican member of the state assembly, Representative Jim Wilson of Salida. So many of these initiatives were actually partnerships between Republicans and Democrats, not, of course, supported by everybody on either side, but really we're finding a way, in stark contrast to the national politics, to really work together to address these priorities.
So all of your states, we're all purple, basically. Governor Brown and I were talking, people see Oregon as being blue-leaning, but in fact, you have a Republican-controlled legislature?
Don't at this point
okay.
in time. But I
Okay.
served in the legislature for 17 years, and 14 of those years I was in the minority.
So you're all leaders of states where people are on different sides of the aisle. What's working in New Mexico and Oregon to get people together around an issue? What do you need to do to unite people? I think that's what we all are hoping for is going to come out of this next election.
Well, as governors, we have to GSD. We have to get stuff done. And for me, that means working across the aisle, or you can put another word in there. It means working across the aisle and around the state. It means putting the priorities of Oregonians first. And of the top 5 agenda items, from housing to investments to education, early childhood education to university system, these are issues that we can work with Republicans, with the business community, with labor on, and we have to. We don't have a choice. We're a very active initiative and referendum system, so we have to bring in the stakeholders and get the support through the legislative process, or grumpy stakeholders refer it to the ballot and we have a ballot fight. So it's really important that we work collaboratively, and we call it the Oregon way, and I'm really proud of that. I think the other piece I would say about states is states are really thought of as the laboratories of democracy. I like to think of the states as literally the petri dishes of progressive public policy. And Oregon has a history of leading on progressive public policy, from environmental issues to voter access. One of the issues that a bill passed in 1973 requiring land use planning, so we grow up to preserve our forest and farmland. That's been extremely valuable now as we work to tackle and reduce greenhouse gas emissions. We have had a history of leading on voter access, because in Oregon we believe that your vote is your voice and every single voice matters. And that's why we were the first state in the country to move to all vote by mail. And I actually crafted and then signed into law the nation's first automatic voter registration system. So as Governor, as Governor Polis said, we have to work closely with our local partners, and we have to work around the aisle, but we also can be leaders, and the work we are doing in our states can impact public policies across the rest of the country. One last example. We passed a minimum wage increase in 2016. We did it regionally. When a former president came to Oregon, he said, oh yeah, Oregon followed New York and California's lead on that. Oregon was the first state to pass it, recognizing regional economic differences, and then New York and California followed our lead. So,
We followed your lead too.
Oh, thank you.
So one more thing, and then I'll turn it back to our wonderful governor from New Mexico with the big microphone, who can wrap up and then we'll open it up. You are all paper ballots, and I'd love you to talk about that for 1 minute.
We became an all vote by mail state in 1998. We have some other ways to vote if you have a different ability or if you're overseas serving in the military, but we've been using paper ballots. I won my first election in 1992 by 7 votes. I was able to watch the recount. I'm not kidding, every vote makes a difference, right? I was able to watch the recount because of the paper ballots. It's replicable, it's secure, it's extremely cost effective. It costs about 20 to 30% less. And besides, it's really convenient and accessible for the electorate. People love it. We know that because people vote in Oregon. Colorado, again, followed our lead on this one. You guys also now have very high voter turnout. So it's secure, it's safe, it's efficient, and people love it. And that's the most important thing.
Great. Governor Lujan Grisham, what's your take? You were in Congress for a long time. Now you're the governor. How do you look at the difference and in the two sort of opportunities you've had to lead? And what does leadership mean in the state of New Mexico from your standpoint now to reunite your constituents?
Well, I do think that not only do I completely agree with my colleagues on this stage about every single thing we've been talking about, and that states have always been innovators because we're nimble enough, and executive, being a governor, you can make those decisions and set those priorities and then work to get them done, that now more than ever, states are, in addition, protecting their democracies, their citizens, and the states. So we're under attack, in my view. I've got jet fuel in the largest aquifer in Albuquerque, and we're going to have to sue the Air Force. We are, like every state in America, very concerned about groundwater contamination from PFAS, which is the fire retardant chemical that all of our military bases were using, and the Congress and the federal government is not working diligently to get it cleaned up. So if your federal government isn't going to protect you when clearly it is their responsibility and they're the cause, then it's governors and state citizens who stand up and demand that we want better for our families. And so in addition to being economic innovators and making sure that we get education right, we are also doing voter protection. We're doing same-day voter registration and really working, we're paper ballots, but working on automatic registration in the next level. And when you solve those problems and you are clear about protecting your citizens and about hearing and reacting to your priorities, your issues, making sure that you recognize that there's a difference in every single community in your state and participating directly in solving those problems, it is a very stark contrast to a federal government that more now, in my opinion, than ever, has abdicated its responsibility to lead. Even if you disagree with the priority, I don't see leadership or action in any number of ways that would translate to making a difference to most American families. And I would say that now, bipartisan, more members of Congress are frustrated by that dynamic than ever before, and I am shockingly pretty aggressive, which is why I'm going to beat Governor Polis at the chili cooking contest that's coming up squarely and fairly. You have to be assertive if you really want to solve people's problems and make a difference, and they got to believe that you will fight for them, that you'll get it done. And being a governor allows you to do that, and I have to say that our states have been remarkable about also bipartisan saying, I may not agree with every priority, and certainly the Republicans in the legislature didn't vote for everything I presented. But in the first 10 days of our session, I asked for a rocket docket that was bipartisan for bills that had been vetoed by the former governor, showing that every single community deserves a governor who will invest in the things that you identify through your elected leaders, your local government, as your priorities. And that begins to rebuild a sense of of bipartisanship in all of our states, and I think it's critical, and I believe that states are making that difference around the country as we
I don't
speak
know about
here
you, but
today.
I think governors in the West are pretty fantastic. They're great. We have a few minutes for Q&A. Right here, sir. Right in the white shirt. Right, hand up, right there. I can't see very well, so I'm sorry if I'm not identifying you.
I've been watching and listening to governors for the last 4 or 5 summers, both Republican and Democrat. And I come away with a feeling that there's a real entrepreneurial capability in every single governor. It's amazing to me how good they are at working at it. The larger states do have a little more problematic stuff than you guys have to deal with, but the bottom line is you're all good at what you're doing. And you prove to us how successful you've been. I don't hear any of you ever saying, yeah, but I do get a lot of money from the federal government in order to do this. That subject never comes off. But I have 2 problems, and I can live with that, I understand. 2 disconnects that I don't understand. Maybe you can help me. One disconnect, of course, you talk about education and what you've been able to do, but the disconnect to me is the Secretary of Education. I mean, she doesn't even agree with public education as far as I can tell. How do you deal with that? The other disconnect, which you talk about when you talk about health care, is the costs. I don't understand how I can have 6 months of some very serious shots put into my arm for my cancer, and the cost is $500,000, and I pay nothing. The numbers don't make sense to me. Maybe you can explain that disconnect also with the pharmaceutical industry.
How about one of you taking that, just so we can go?
I'll do the Secretary DeVos one, and then we can just do my colleagues could do the other one. Yeah, I'm a good vantage point for that. I was a ranking Democrat on the early childhood, kindergarten, and 12th grade subcommittee in Congress, so I've cross-interrogated Secretary DeVos, and then of course when she visited Denver, I met with her a few weeks ago. We obviously work with the administration. In education, the federal contribution is under 10%. In our state, it's somewhere around 7 or 8%, and it's largely formulaic. And Secretary DeVos and the Trump administration were not able to get any major changes in that formula through the United States Congress. They proposed some that would have directed some of the money for high-risk Title I kids to higher income schools. We opposed that. It didn't go through. They're still distributed formulaically to the schools that need it the most. But their ability to do harm has been prevented by Congress, even when both chambers of Congress were controlled by Republicans. There was really no significant part of Secretary DeVos's education agenda that passed into law. So again, we are involved with the Title IX lawsuit and efforts. They repealed the guidance around Title IX. There's things like that. But on the formulaic and economic piece, there really haven't been any great changes because Congress has really stood up to that.
Governor Brown, do you want to talk about a $500,000 bill that costs nothing to the user?
And I know I may not be able to answer your question, but I will tell you what we are focused on and where we're going. And under our Oregon Health Plan, our Medicaid population, we are controlling the cost growth rates by limiting how much more resources we will put in. So it requires all of our providers at every step of the way to be focused on outcomes and values and product and people and patients as opposed to particular treatments. And so it has been a very effective approach to controlling the crazy cost growth that we're seeing in healthcare. But the other piece is that we've gotten a federal waiver to allow some flexibility in terms of how our dollars are being spent. So for example, a woman coming to the emergency room because the temperature was 100 degrees and she was continuing to have health problems. Under the Oregon Health Plan, through our CCO model, our coordinated care organization, the CCO purchased an air conditioner for her. And she didn't have to keep coming to the emergency room to get the treatment she needed. And I can go on with stories like that. So we have been really focused on what we're calling the social determinants of health and how we can bring down the costs of healthcare and get much better outcomes for our people. I don't know if the former Secretary of Health can answer your specific question.
So, cost shifting and lack of transparency is how you're not paying for anything, somebody else is. And so, because we don't see where it all happens, you'll have an insurance company that also owns a nonprofit hospital. And they do incredible cost shifting, and they leverage federal programs in ways that they're not intended to be leveraged. And then we shift that cost to a private consumer or a private insurance package. And pharmaceutical companies say, oh, you don't have to do what the great governor of Colorado did by capping prices, because we'll give insulin for free, just call us. No. I want to see those costs, and what we need in the federal government could be a big help, but in New Mexico, we're going to require transparency for everyone: hospitals, insurance companies, providers, and pharmaceutical companies. And states have a lot more power than we think. Our public health systems purchase a whole bunch of drugs. The veterans hospitals could use our support. Even on the veterans, they do a better job pricing drugs, but they're having some trouble. We can start to leverage, and I think we should regionally leverage, so that we start to create purchasing power, transparency, and accountability at all levels, because that will prevent that cost shifting. So when I was in Congress, I said, look, I introduced legislation, I couldn't get it passed, but you know, there's a formula we use to figure out how we protect hospitals and pharmaceutical companies and insurance companies, and it's the medical loss ratio. So we operate under this system where we think they're all losing money, and then we figure out a way to cover it somewhere else. And I said, the providers shouldn't be sending to Congress what they think their medical losses are, because they all have a nonprofit arm or an emergency room, and they just shift losses back and forth between private and what I would call so-called nonprofit health structures. So there has to be a private audit. I get to decide based on looking at the facts whether there's a real loss and what we do about it. So we need transparency. It may be the only thing that I've ever, well, that's a bit harsh. I often disagree with the current president, and when he said healthcare was so complicated, he was right about that part, but when he said who knew, everyone knew, except for him, apparently. So we have to demystify healthcare. It's complicated on purpose, because then it makes it harder for us to reform, and states are going to lead the way.
I think we're out of time, everybody. Will you thank our wonderful guests? Thanks again to Bob and Soledad. Thank you all for coming.